This is the office of Cedar Hills Family Practice, located on Southeast Military Drive in San Antonio, Texas, where Dr. James Williams and his team of medical professionals are helping patients improve their lives. As healthcare remains a hot topic and legislative changes cause the medical community to evolve, Cedar Hills continues to be focused on one goal: improving the lives of their patients. Meet Dr. Williams, founder and medical director of Cedar Hills Family Practice.
Our goal here at Cedar Hills Family Practice is make sure that everyone is better. I want to make sure that regardless of what is going on with you, that when you come to our clinic, you leave here with the feeling that you feel better, your health is improved, and we've given you the tools to help you achieve long-term health.
Cedar Hills Family Practice provides treatment for ailments such as arthritis, diabetes, hypertension, and peripheral neuropathy. For the convenience of their patients, Cedar Hills also provides in-house labs, testing, and studies. Dr. Williams provides extensive diabetes instruction that works with the diabetes program to educate patients about healthier options. Diabetic peripheral neuropathy is a serious and growing problem in the United States. Cedar Hills is one of the few practices in San Antonio that provides a unique and effective treatment for diabetic peripheral neuropathy.
Signs or symptoms of neuropathy include numbness at first of the feet, maybe just a little numbness, then a little tingling of the feet, and then sometimes it depends on the patient, but they have different symptoms. Some burn, some hurt. The commonality between all of them is that they have a change in how their feet feel after the neuropathy starts to progress. So I'm going to feel your foot right now, and I want you to close your eyes, and I want you to tell me if you feel something. If you feel it, say yes, okay? If you don't feel it, obviously you're not going to know it, okay? Look at me right now so you can see this. See how that's bending and you're not feeling it? So you're not unusual, but we do have a treatment, and the treatment actually brings back the functioning of the nerves. So a lot of times, a lot of the pain and numbness and tingling and burning, it goes away with the treatment. The treatment is pretty much 100% successful at improving, and about 60 to 70% of the patients actually get complete resolution of the problem.
We came to the conclusion that I was having neuropathy, so we started the treatments, and the treatments have been very helpful to me due to the fact I wasn't able to rest or sleep, and I had a terrible burning sensation. And since I've been going to him, that sensation have been eliminated through these treatments.
Well, I couldn't stand if nobody touched this arm. And actually the other day I let them put the blood pressure cuff on that arm. If you just touch it, it hurt bad. But most of that sensitivity seems to go away, and it doesn't quiver near as bad as it used to.
Cedar Hills also works with patients who suffer from joint pain or discomfort that have not seen success with other treatments.
Over the years, your knee joint breaks down due to being overweight or overuse. The cushion between the bones breaks down, and eventually you get bone on bone. So what Hyaluronic does is we put the injections in there. It's hyaluronic acid. It's a natural compound that we put in the joint, and it slowly builds that cushion back up so we no longer have pain in the joint. But in all these patients, it can delay the need for joint replacement or other operations to help these patients.
My knees has been rubbing up against each other, and so Dr. Williams is giving me these treatments, and I'm thankful because I don't want to have surgery again. When I wake up in the morning, I couldn't hardly walk on my leg, and now I'm able to do that. I can play around with my grandkids and my great-grandkids, so I'm feeling real good about it. I really am.
As many people struggle to lose weight, Dr. Williams is committed to providing his patients with a medically managed weight loss program that has been proven to have you losing inches fast. While patients do lose weight rapidly, the program at Cedar Hills Family Practice is focused on long-term changes that keep the weight off and improve the patient's overall health.
I was 230 pounds about 2.5 years ago when I discovered a diet program. I was in charge of a medical weight loss clinic, and I was working with a diet, and I was actually making some changes to it, and eventually I decided to use it on myself. In the process, I lost 85 pounds. In 6 weeks, patients will lose anywhere between 20 and 40 pounds. And we go through everything with you. We have multiple visits to make sure that you're doing really well in the weight loss program, because our goal is for you to be successful completely in learning how to eat and eating better and achieving your weight loss goals.
Your size of your protein that you have for lunch and for dinner is this big. So your piece of chicken, fish, or steak is this big. And at first I was like, really, am I gonna die? You know, with the supplements they give you and the B12 shot that you get once a week, you're not hungry. I was never hungry, not one time. There's not any pressure from them. I mean, you come in, get your shot, and they say, do you have any questions? How do you feel? I've been on the program for 42 days. I've lost 46 pounds.
I have just completed my 40 days. I lost 21.5 pounds. And when I started, Dr. Williams told me that if I did exactly what he said to do and ate only what's on the diet, that he would guarantee that I would lose 15 to 25 pounds. Of course, I didn't believe him because I've tried other programs, but I have lost 21.5 pounds, so I'm excited. It's not so much about the weight that I lost, but my numbers that have come down. You know, I'm high risk for heart disease and diabetes, so it was important to me to decrease those numbers.
Cedar Hills Family Practice works with every patient to find the healthcare solutions that will work best for them. Dr. Williams and his staff take pride in their work and strive to treat every patient with respect and care.
One of the biggest differences at Cedar Hills is the employees caring for their patients. Knowing that they're there for their patients no matter what they're needing for, we're there for them.
Love the patients. The patients are so nice and caring, and they're just so genuine. I just love it. I love always being there for them.
I just thank God that there's things out there to help you when you have pain like this and when you don't want to have to go through knee surgery again.
I mean, I can definitely see a lifestyle change.
He's such a thorough doctor that checks everything, and he discovered that I had neuropathy. When he told me that they had a new treatment that was helping people, I went for it, and I'm so glad I did.
And he's been there, you know, and I think that makes a big difference because you're working with somebody that did the program and it worked.
I've been seeing a doctor for 37 years, different doctors, and nobody had done what he's done in 3 months.
8 years I never straightened them fingers. I never wiggled that thumb. But it's helping. It's working. I'm telling you, it's working.
At Cedar Hills Family Practice, Dr. Williams and his team strive to make a positive difference in all areas of your health. Call 210-298-4711 to make your appointment today.